Hey everybody, Dr. Grant here, and today we're going to be talking about specifically what I've done like over the years, working with people with ADHD. That I've done over 11,000 different lab tests on ADHD patients, and I've learned these very specific things. And if you want to follow along, there is the workshop in the description that you can download these slides and for your own, and also be taking notes. So the very first thing that when it comes to ADHD that I've learned is the biggest issue isn't necessarily dopamine. Um, it is a big contributing factor, but it's not the biggest contributing factor when it comes to different ADHD issues. And so when I run different labs and been doing this for over now 10 years, and what I've seen across the board as far as the data is that serotonin is actually a pretty big contributing factor when it comes to your lack of motivation. In fact, the people that we've tested and we've discovered is that serotonin is about 66% of the people that we test has an issue where they're low, just like this patient is. That's huge. I mean, 66%, there's a likely chance that you probably have low serotonin levels. If that's the case, that impacts your motivation and drive. And then on top of that, there's also the opposite. And it's what we call a serotonin syndrome that can cause side effects of, agitation, irritation, anxiety, heart palpitations, probably some symptoms that you have. Let me know in the chat if you guys experience that. Are you more anxious and stressed? Let me know in the chat, because if that's the case, there's a chance that maybe you are dealing with something known as serotonin syndrome, just like this patient was. When we ran these tests, these were elevated. And because what we have found is that serotonin, that's when it's elevated, about 20% of the people that we do test tends to have elevated serotonin levels. And it's not a good situation to be in, because it can even lead into like hallucinations, and you can't function. It's just not a good situation to be in. And this is something that needs to be addressed ASAP. Typically, this is because maybe you're on an SSRI and you're at too high of a dose, or there is maybe an interaction with your medications. And maybe you're taking some supplements that are interacting with it and causing some severe issues. And so when this happens, we have to start making adjustments as far as changing the dosage of maybe the medication, also possibly using other supplementation to help lower these numbers down. Typically, it's going to be things like rhodiola, L-theanine can help lower this down, and a combination of other things as well. But typically, there is a reason, a root cause of why it's being elevated. Typically, a lot of times it's going to be your medication. Now, the other thing to also keep in mind is that even before dopamine, there's other things that also can contribute to your ADHD situation. And one of those can also be GABA. GABA has to deal with managing your stress. So we are talking about stress a lot because guess what? A lot of people with ADHD have stress. Let me know in the chat if you deal with stress with your ADHD, because about more than 50% of people with ADHD typically deal with, in general, anxiety disorder. And so when we test people with GABA, when we see it deficient, which helps manage stress, we say that about 38% of the people that we do test is low in GABA levels. And generally that needs to be addressed. And then on top of that, glutamate, which also helps with making GABA, is that we did found about 18% of the people that we did test was low in glutamate levels. And then glycine, that's even a more big one, is about 30% of the people that we test was low in glycine. Glycine also helps with a lot of different neurotransmitters. And so it's very vital to have a good, healthy balance with that. But that's what we've discovered over the past 10 years running these different labs that have been doing. Okay. So, yep. So it looks like we got a lot of people here. We got all the way from Canada. Hola. We got yes, definitely more stress. Wakaza says yes, stress every day. Yeah, it's very common to see stress creep up every day with people with ADHD. So that's why I'm addressing it here, because it's something I see every day. Now, the opposite also can happen, just like with serotonin with GABA, is that we can see an elevation in GABA. And so you always want to be a nice, happy medium with your neurotransmitter levels. Because if you go too high, then you're going to be too stressed, especially with GABA. If you're too low, you're not managing the stress, or managing your GABA levels are not well balanced. And so therefore, it can't manage stress very well. And so usually when it's elevated, we see about 28% of the people that we test tends to have elevated GABA levels. And so just like serotonin, typically there's going to be a combo of things such as like L-theanine, rhodiola that need to be used. Usually with serotonin, I forgot to mention this before as well. Typically, it's usually the breakdown. So, like vitamin B2, vitamin B3, iron that might be deficient, SAMe will help break down serotonin. So, sometimes it's that serotonin is not being broken down, and that could be another reason of why serotonin is elevated. Okay. Now, another one that people don't talk about at all is these two things right here, histamine and taurine. So, histamine, people think about it as it's just related to allergies. Sure. If you have too high histamine levels, then you are more prone to typically allergies and stuff like that. But histamine is also very important to have a nice healthy balance because it is used for as a driver to build and modulate different neurotransmitters. So I do see it low pretty frequently. In fact, what we have tested, what we have found is that about 64% of the people we test with ADHD tend to be low in histamine. So we use something like L-histidine, supplement that to help improve those levels because that's going to help build and modulate the different neurotransmitters and helping with your ADHD. Okay. Taurine, on the other hand, is an amino acid. Typically, it helps make GABA and some other different neurotransmitters. But taurine that we usually have found, let me make sure I have my numbers here right, is 32% of the people that we test tend to be low in taurine levels. It's quite a bit, right? So all these numbers, I mean, like about 1/3 to even like 50 to even 60% of you guys probably watching this video probably have one of these things that might be out of balance or several of them. Okay. Now, another thing that we also did find over the years, and this is a big one. You guys probably have heard me. If you've been following me long enough, you probably know what I'm going to say here. But I got to stress this point so much because this right here, phenylethylamine, is an excitatory neurotransmitter that helps with motivation, focus, memory. Everyone likes to talk about dopamine, but they forget this guy right here. It's an excitatory neurotransmitter that's so responsible for this. I see this deficient more than dopamine. And what I see this is phenylethylamine. In fact, I would probably use this if I was trying to diagnose someone with ADHD. If we didn't use just the DSM-5 and just do a questionnaire and just guessed, just based off of like how people respond. But if we want to use labs, this is probably the next best thing I would say because 91% of the people I have tested with ADHD is low in phenylethylamine. That's most of you guys watching this video. Most of you. Okay. So if that's the case, then we should be dressing probably that more frequently than actually dopamine itself. So how do we fix that? You guys probably watched some of my videos on this, but yes, doing like DL-phenylalanine, the amino acid that helps make phenylethylamine. You could also take phenylethylamine directly to improve these levels. Now, the thing with taking phenylethylamine directly, it's short-acting lived. So that's why I usually like using the amino acid DL-phenylalanine. It's going to give you more of a long-lasting effect. Now, there's other few things that also need to be addressed before dopamine. Norepinephrine and epinephrine. We see those low, and that has to deal with a lot of stress and also can impact your focus with ADHD. And what we have seen as far as across the board on these numbers, let me make sure I got these right. So norepinephrine, 60% of the people that we tested was low on it. But guess what? Epinephrine, 98% of the people who've tested. So that's basically most of you guys on this call probably have low epinephrine levels. So stress is a huge factor when it comes to people's ADHD. Huge. And it's definitely overlooked. And it's something that we need to bring back into balance when we see things like this. Now, I am going to talk about dopamine because it still is a important factor to your ADHD. But when you watch videos and see people just talk about typically dopamine, that ADHD is just a dopamine problem, but it really is not just a dopamine problem. It's a factor, but there's multiple factors when it comes to someone's ADHD. But when it comes to dopamine, when we've tested it, we see that about 48%, so not even quite 50%, people we test has low dopamine. Still quite a bit, but it's not the number one biggest issue. And so when we do see this, yeah, it needs to be addressed, of course. And a lot of times we see that medication doesn't do its job. Like this patient right here from this case study of this test, he was taking medications, but still was not giving him enough dopamine. And why is that? Because it's usually the things that help make dopamine, even cofactors. It's the ingredients that makes dopamine. So if the ingredients, like you're trying to bake a cake, if you don't have all the ingredients, you can't make more of that cake. That means you can't make more of dopamine if you don't have all the ingredients. So that generally is usually the issue. Isn't it that we need to just stimulate dopamine? No. Can it help? Sure. But if there's not enough ingredients to squeeze out the juice of more dopamine, there's not going to be more dopamine coming out, or at least more than that you need because you're lacking in ingredients. And this is where we look at other factors. Actually, I'll get back to that in a minute. Where did it go? I guess I forgot to put that slide. Sorry. Okay. I forgot to put it in here, but I was going to mention is tyrosine. So tyrosine, which is right here, we see that about 55% of the people that we test is low in tyrosine. I already told you about phenylalanine, it's 91%. So both of those alone are a bigger issue than dopamine because those are the ingredients to helping making dopamine. So it's making sense so far. Let me know in the chat if this is making sense. The other thing is also the opposite that we also have to keep in mind is dopamine. I don't see this as often, but it does happen where dopamine can be elevated and can cause agitation, irritation, just like serotonin syndrome. And we only see about 10%, but it's a factor. 10% of you guys probably watching this could end up having a dopamine issue where it's elevated. All right. Marissa, does this make sense? Awesome. Great. Yeah, I just want to check in with you guys. Now, a few other things that also, there shouldn't be vitamins that also, remember I told you about how there's cofactors here, right? These are what help make the different neurotransmitters. Well, that requires different vitamins, different micronutrients. So vitamin B6, we see about 60% of the people that we've tested tends to be deficient in this. About 50% of the people we test for vitamin B12 tends to be deficient in that. Vitamin B3, this is actually roughly about 55% of the people we test. So vitamin Bs, B12, B6, B3s, more specifically, which actually help a lot with neurotransmitters and with your ADHD. About more than half of you guys on this call probably have some issues with this. That's if you have ADHD. Obviously, I specialize working with adults with ADHD, high achievers. Now, zinc, on the other hand, make sure I have my numbers here right. Zinc, where did it go? There we go. 29% of the people we've tested is low in zinc. Okay. Now, why is zinc important? Because zinc is also another cofactor. So cofactor, when I say cofactor, that just means, just think about it, ingredients for making the cake, ingredients for making dopamine, the ingredients for making GABA, serotonin. Just think about that. Cofactor is part of the ingredients. Now, vitamin D, on the other hand, D3, this definitely impacts energy, but it also is responsible for making different neurotransmitters as well. And we found also, yeah, that's right. This one was also about 29% of the people that we tested was severely low in vitamin D levels. So huge factor. Now, another really big one has to do with cortisol. Cortisol is what gives us energy and manages our stress. But when it's off, it also impacts our motivation and focus as well, you guys. And 92% of the people I do test tends to be low in cortisol, like this person throughout the entire day. You can't function. It's really hard to function when it's low. But sometimes the opposite happens where it's too high. And now you're agitated, stressed, you're not getting good quality sleep because your cortisol levels are too high. And usually with this case, we see about 22% of the people that we test. Now you might be asking, like, oh, how does that add up 92 to 22%? It's because sometimes we see it low and high. So I'm just giving the numbers of like what percentage do we see at least if there's a low cortisol, but sometimes we see it where it's both, where we'll see it low and also high, just like this case. Okay. And then sometimes we see it really bad, where it really spikes really high. And that can cause some really disrupt in your life and causing some havoc in your ADHD. But guys, this is really what's required. It's like, it's hard to really know what you don't know unless you look inside of your biochemistry to see what are the imbalances. I mean, you can play all the guessing games of trying different supplements and random supplements and hope for the best. But how's that been working out for you? My guess, it probably hasn't got any results. Otherwise, you wouldn't be here. If it was getting you the results, then you wouldn't be here. Because you can't just take random supplements. You got to actually look at yourself. Like, it's like, what's the biochemistry imbalances that are happening to you? So you have a complete roadmap. That's the only way how I'm able to do my job effectively, is that I have an actual roadmap to give an effective treatment plan that's actually going to get results and lasting impactful results, not just get rid of symptoms for a few weeks. And I know a lot of you guys who take supplements. Maybe it works for like a week or two, but then it just goes back to where you were before. Same with your medications, right? Now, some of you are lucky where the medications don't cause you as much havoc, but you're probably not on this call if you're one of those people. So, I mean, if you would like me to order these labs, I'd love to help you out, like, and identify the root causes to your symptoms. Because if you're wanting that and actually getting the same kind of results that I do with my patients, you just book your first initial consultation with me. It's called ADHD Diagnostic Focused Diagnostic Assessment. It's a 45 minutes with me. Normally, it's a $750 value for my time, but don't worry, it's discounted. But I do want to mention that, like, I'm only able to, because I'm so heavily involved in our program and helping our patients. I'm only able to give like 6 to 8 slots per week. So I usually can't have that much. So these do get filled up pretty quickly. So just keep that in mind. But if you do book with me, what's included when we have our consultation together, I go over your medical history and I actually still put together like a roadmap of what labs you should do, whether you work with me or not. Like, if it doesn't seem like it's a good fit, at least have a roadmap of what labs, and you could go to a different functional medicine doctor. I don't care. Right. I just want to help you out. The other thing else you get included with this is, if you do decide to join the program and you do get qualified, then you get to use that $97 towards labs. Okay. So it's basically over $1,000 value. There's no exaggeration here. This is actually really what I used to charge for it, for the initial part of it. But it's only $97. Okay. I mean, that's less than really if you were to take a break from coffee, which, I usually recommend for people, what you probably pay in a month in coffee. It's probably less than what you pay in your cell phone bill, right? So just for $97, you can actually get a roadmap and an action plan to finally tackle your ADHD. And also on top of it, I do give you 100% money back guaranteed. So as long as you do show up to your appointment, you can, and if for some reason we're not a good fit, you can actually ask for your $97 back. Okay. No hard feelings. You can ask for it back if we're just not a good fit. So there's really no risk here. All you got to do is click on the link in the description below, and hope to see you guys in this side. If you have any questions, just reach out to me. You can email me. But yeah, thank you guys so much for attending, and I'll see you guys all on the next live workshop. Thanks. Bye.